Good afternoon. Welcome to this general session. The name is Advancing the Workforce Equity for Promotoras and Community Health Workers. My name is Alma Esquivel. I'm the Training and Education Director of Visión y Compromiso. And it is my pleasure to join this conversation with Maria Lemos, our Executive Director, and also will be helping us also and participating in the questions, Melinda Cordero, that is the Associate Director of Visión y Compromiso. I would like to start with a brief introduction about the work that Visión y Compromiso has been doing during the last years in order to advance this equity for promotores in the workforce development. As many as you know, one of the main focus of Visión y Compromiso is to make sure that promotores are integrated into the workforce in the best way possible for them. We started doing this work a long time ago. And as an example, in 2014, we bring together a panel of experts to have conversations about what are the necessities or what we need to do in order to advance equity in the integration of promotores in the workforce. We work with these leaders in this advisory group to just get to know, and the results that we receive from those conversations were published in our paper that is called The Key Workforce Priorities in the Community Transformational Model. I'm sorry, I didn't mention that this session will be in English. And if you need interpretation to Spanish, there is an icon for interpretation in the bottom of the screen. With this paper that is being published, and you can find in our website, the key workforce priorities for the community transformational model, we highlight 6 priorities that were part of those conversations, what we need to do in order to advance the workforce equity for promotores. The first one is how important it is to get to know the promotor model, the promotor community transformational model, and the way the promotores contribute to the well-being of the community. The second priority is the importance of training and professional development. That is being part of our work with the network with Visión y Compromiso. Promotoras always express the importance of continuous training and education. Also, what is the core competencies and curriculum for promotores? What is those abilities and information that the promotores can obtain, but also the essence of the promotor, and to give them the importance that this have in order to continue to do the best work for the community. The credentials or qualifications that the promotores will need in order to be part of those different teams that they will be supporting. And not less important, the supervision of promotores. What are those different things that we need to have in mind when we are supervising promotores? And the importance of funding the program and the sustentability. All those 6 priorities were talked about and different conversations with different leaders. And all those conversations are part of this paper that we published and that is available for all organizations and all collaborators that are interested in learning more about those conversations that we have. But our work didn't stop there. We also want to hear from the promotores. Our promotores also have different focus groups and conversations. And we ask them what is important to have in mind in order to integrate the workforce. So with those conversations with promotoras, we also create a curriculum, workforce readiness for promotores. So promotoras participate in developing the tools that will help them to integrate or to be part of the workforce. Also, we have those same conversations with organizations. What else do we need to know in order to be prepared to integrate promotores in different programs? And we design the organizational readiness program to help other organizations to also collaborate with promotores and integrate them in the best way possible. Visión y Compromiso is committed to continue support the development of the promotor, support the organizations that integrate promotores in the workforce, and also continue to do advocacy for the promotores and at the different levels. Our institute is just one of the ways that we support promotores to be prepared for the workforce. The institute has been launched in the last year. We have our first cohort of promotores that graduate from the first stage of the institute, and we will continue working this year with the institute and continue to support the organizations and the different needs of promotores. Today, we have a panel of experts that are joining us in this work to support the promotores for the workforce equity. I would like to present two partners that will be joining us as a panelist today and share with all of us those conversations that are being held in the different areas and the different sectors. And it's my honor to present Gabriela Barbosa. She's the Managing Director of Policy at the Children's Partnership, where she leads the development, implementation, and supervision of a multitasking and multi-use advocacy agenda, focused in advancing systemic changes that protect and promote the health and the well-being of children from historically marginalized communities through public policy, research, partnerships, and community engagement. Also with us will be Dr. Aquino. She serves as a Deputy Director of the Latino Coalition for Healthy California, the state-leading policy organization advocating for health and equity in the Latino community. In her role, she is responsible for building and activating the infrastructure needed for further strength organizational, financial, policy, and program development while advancing the Latino Community for Healthy California external strategy. Join me in welcome our two wonderful panelists for this afternoon. Welcome, Gabriela.
Thank you so much, Alma, for that wonderful introduction and for all of the work that you do with Visión y Compromiso. It's wonderful to be here. If you can move to the next slide, please, as we start our presentation. Great. We have a great presentation for you all. Myself and Dr. Aquino will be presenting on our work supporting promotores and the workforce. So I will start just by describing who our organization is and the Children's Partnership. Thank you for moving the slides. Next slide, please. And then one more time, perfect. So the Children's Partnership is a child-focused advocacy organization working to improve the health and well-being of California's children, specifically children of color and children from immigrant families. We envision a California where all children, regardless of their race, ethnicity, or place of birth, have the resources and opportunities they need to grow up healthy and thrive. And our mission is to advance this vision of child health equity through research, policy, and community engagement. So in the last couple of years, we've been exploring how children have been harmed by systems and policies that shape the conditions where they live, learn, develop, and play. And we've been releasing a series of policy briefs and reports focused on highlighting these issues. And in these reports, we consider opportunities to disrupt oppressive systems and defer to community leadership and demand bold innovations. And that's where our community health worker and promotores work falls in line for us as an organization. One of the briefs we released just a couple months ago focused specifically on how a community health workforce and promotores specifically protect and improve the health of children of color and children from immigrant communities. So I will stop there and pass it to Dr. Aquino.
Thank you so much, Gabriela. Muy buenos días a todos. It's such a pleasure being here with you all today. It is an honor to join you all in this wonderful conference. I hope you've been having wonderful conversations I know this presentation and the many presentations that you've all had has been very intentional. So thank you for having us. As you heard, my name is Ceci Aquino, and I am the Deputy Director at the Latino Coalition for a Healthy California. If we can advance the slide, thank you so much. So just to give you a little bit of background on LCHC. So for over 29 years, LCHC has been serving as a statewide policy and advocacy organization solely focused on protecting and advancing Latinx health equity. Our work consists of community-centered programming, policy advocacy, and strategic communication. Our mission and vision really work together to address the disparities in the Latino community in California. Yes, next slide, please. That would be wonderful. Perfect. And the way we do this is really by intentionally centering the voice of community members. And so we like to say that we do this by translating community solutions into equitable policy and lasting change. Next slide, please. And one more time. Perfect, thank you. In order to advance this work, we do so through applying a social determinants of health framework to our work. And as Gabriela mentioned just a couple of seconds ago, social determinants of health are the conditions in the environment where we live. So it's where we're born, where we live, where we learn, where we work, where we play, where we worship, and where we age. And all of that really affects our whole being, and it affects how we grow up, how we interact with our environment, and ultimately it affects our health. Next slide. And we know it's of utmost importance because 60% of premature death is determined by social, environmental, and behavioral factors. So if we're not protecting our environments and how it's affecting us personally, we are definitely affecting our health outcomes. Next slide, please. Our work relies across 3 specific departments: our communications, policy, and programs department. And as you can see here with the Bar High Health Equity Framework, we work across social inequities, institutional inequities, and living conditions, in addition to addressing some education regarding risk behaviors that we have in our communities. And our work, as I mentioned, really centers the voice of community. Promotoras, like you all joining us today, really make our work effective, efficient, and lasting. We couldn't do this work without all of you. One more slide, please. All right, and now we'll get into the nitty-gritty, some data, just to set the stage as we continue to have this conversation with you all today. I'll go through some data regarding the Latino community in California, and then Gabriela will walk us through some data regarding children in California. If we can advance to the next slide, please. And the next one. Perfect, thank you so much. So as we can see here, Latinos are the plurality racial ethnic group in California, and we're expected to continue to grow. As you know, many promotores, and the majority tend to be from the Latino community. We do have representation from other ethnicities that do this work for their communities, but for the most part, when we're talking about promotores, we are talking about the Latino community. As you can see, we will be rising from a 32% to a 43% by 2040. And so that is a huge increase. And we know for a fact that if we don't get our game straight right now, then we'll need to adapt in the future. So it's better that we have a plan on how we want to move forward now so we can achieve it. Next slide, please. So this slide will look at health insurance by race and ethnicity. As you can see, the Latino community tends to be uninsured or enrolled in Medi-Cal. So Latinos are 12% uninsured in California, and 44% of the population is in Medi-Cal. Next slide, please. Our self-reported status, or the Latinos tend to self-report in being in fair or poor health condition. And as you can see, this is higher than across other groups in California. Next slide. What I would like to highlight, and I think many times for the Latino community, it's a lot of highlighting those barriers and those inequities, but we are such a powerful people that even beyond all these systemic issues and barriers that our community faces, we continue to strive forward. And actually our life expectancy tends to be higher than across other groups. And so for Latinos, our life expectancy is 83.2, which is higher than the white population in California. Next slide, please. However, as we face this pandemic, this year and a half, almost 2 years, unfortunately, we have seen that Latinos are overrepresented in COVID-19 cases and deaths. This data shows data from September 14th this year. And if you can see, the number of deaths were at 30,000 deaths. And that's humongous. If you think about that number and how it impacts a Latino family across the state, an average family has 3 to 4 members. Think about, multiply that number by 4 and think about how that is affecting our community as a whole. Next slide, please. And we know why. So for the most part, Latinos are overrepresented in essential occupations, which means that we are risking our lives to continue to maintain the economy open and continuing to move the state forward. So really, we owe our Latino community the great work and where the state is at currently. We can advance to the next one. And despite our representation in lower socioeconomic status, Latinos contribute greatly to our US GDP. So in 2017, the Latino community shared 2.3 trillion of the GDP. If we were our own country, we would rank 8th largest economy in the world. That's huge. And we continue to grow and evolve. So let's remember that. Let's remember our power as we engage with any kind of system within our realm. Next slide, please. And now we'll pass it on to Gabriela.
Thank you so much, Dr. Aquino, for that wonderful presentation on data. So at this point, I'm just going to go a little bit over some data specifically focused on painting a picture of what California's children look like, and then also get deeper into some data on Latinx children. If you all can go to the next slide, please. Great. So the Children's Partnership, in the last couple of years, we've been producing a series of fact sheets focused on different children groups that try and highlight demographics of different children groups, things like their race, their ethnicity, whether or not their parents were born in the United States. But it also tries to highlight some of the barriers that children are facing in their lives that also impact their health. So we've released a fact sheet focused on Native American children's health in California. We've released one on Black children's health. We've also released one on LGBTQ youth, one on Asian American and Native Hawaiian Pacific Islander youth in California. And then finally, we just released our last one focused on Latinx children youth in partnership with the Latino Coalition for a Healthy California. So I'm just going to go over some data points that we've been gathering as part of this snapshot series. Next slide, please. Thank you. So California's children are really are very diverse and make up a really big population of our state. Our state has around 34 million people, I believe, and children make up 9 million of those. And 75% of California's 9 million children are Latinx, Black, or Asian American, or Native American. Within this group, though, it really is Latinx children who make up the largest share. Over half of our state's children are Latinx. Next slide, please. So another population that we focus on here in the Children's Partnership are children, immigrant, and mixed status families, who are also a significant portion of our state's population. And the reason why we highlight this data is because we also know and understand that even immigration policy itself is a determinant of health, where children experience trauma, mental health, and even economic stability from immigration policy that tears families apart. And what I mean by mixed status families are a family whose members include people with different citizenship or immigration statuses, including, for example, families where the parents are not citizens, but the children are US-born citizens. And in California, roughly half of our children have at least one parent who is born outside of the United States. And about 1 in 8 children have at least one parent who is a non-citizen. Next slide, please. In addition, California's children in immigrant and mixed status families themselves come from diverse backgrounds. There are about 250,000 children in California who are not citizens. And as you can see from the chart, our state population of children who are not citizens are not a monolithic group. They are diverse, who come from various racial and ethnic backgrounds. Over half, or 207,000 children, from this group are children of color from Black, Asian American, Latinx, and Native American Black backgrounds. Next slide, please. So quickly just updating a couple other points of data across California's children. Nearly 1 in 10 children and youth in California identify as LGBTQ. About 1 in 2 children across our state live in a low-income household, and about 1 in 5 are experiencing poverty. In addition to that, we know that family income is just one factor of financial security. Housing is also incredibly important. And there's also data that shows that children in Latinx households are also experiencing burden of housing costs. 41%, or 3.6 million children, live in households with high housing costs. Additionally, about 13% of children, or 1.1 million children in California, have special healthcare needs. And special healthcare needs are needs where children have increased risk for chronic physical, developmental, behavioral, or emotional conditions, and also require health and related services of an amount beyond what is typically required by children. Next slide, please. Okay, so just going over some data that is now specific to one child group in California, Latinx children. And the reason I'm highlighting some data specific to Latinx children is that I understand that many attendees, including myself as a panelist, are Latino and identify as Latino and also serve majority Latino communities. And as I mentioned, we published this fact sheet earlier this month in partnership with the Latino Coalition for a Healthy California. And as you can see, California's Latinx children and youth are themselves a large and diverse population of California who navigate multiple intersecting identities, cultures, and languages. Latinx children make up a majority of our state's population under 18. Like I mentioned earlier, 52% of our state's children identify as Latinx, translating to over 4.6 million children in California. And as I mentioned, Latinx children in our state are not a monolithic group. They are very diverse. About 1.8 Latinx children identify as mixed race, 36,000 identify as Afro-Latinx, 44,000 identify as Native American as well, And about 27,000 Latinx children in our state also identify as Asian American children. And nearly all Latinx children, or 96%, are US citizens. But a lot of these children do rely on adults who are not citizens. Like I mentioned earlier, they live in households where at least one family member has a different immigration status or is a non-citizen. Next slide, please. So there's so much strength that the Latino community and specifically the Latinx child community has in our diversity and in other really protective qualities that we have as a culture. But Latinx children are also facing a number of challenges when it comes to their physical, mental, and oral health. And these challenges really begin with the ability to access health coverage and health services to begin with. And you'll see in this data that about 214,000 Latinx children in California still don't have health insurance. And nearly 1 in 3 or 1.5 million Latinx children, although they might have health insurance coverage, it isn't continuous or adequate for their healthcare needs because they lose coverage during the middle of the year. Moving on to whether Latino children are receiving something called preventive services that help prevent disease from developing later on, only about 19,000 or 874,000 Latinx children did not receive a preventive checkup. And only 25% of Latinx children have been screened for risk of developmental, behavioral, and social delays. Next slide. Oh, sorry, health slide. The oral health slide is where I'm at now. Additionally, when it comes to their oral health, Latinx children are impacted by the highest prevalence of tooth decay compared to their peers, with more than 72% of Latino children having experienced some form of tooth decay compared to 40% of white children. Next slide, please. And then finally, Latino children in California are really facing severe mental health issues. Latinx youth are dealing with higher rates of depression compared to their peers, but are also less likely than their peers to receive mental health treatment. So overall, 1 in 2 or 52% of Latinx teens felt chronic sadness or hopelessness in 2019. Latinas in particular are facing the greatest disparities when it comes to their mental health. 62% of Latina teens in 2019 felt chronic sadness or hopelessness. And 34% of Latina teens have considered suicide. For lesbian, bisexual, and queer Latina youth, the reality is even worse. Nearly half have considered suicide, and 1 in 3 lesbian, bisexual, and queer Latina youth have attempted suicide. But alarmingly, despite these mental health needs, in California in 2019, 75% of Latina teens did not receive psychological or emotional counseling. And I know the statistics in this data is very difficult and very alarming and very shocking. I just think it's important to note that this is a huge issue impacting our Latinx community, specifically our teenagers, that should be addressed. And actually, I'm going to stop there. Next slide, please. I'm going to actually skip this slide for the sake of time. So this slide just really quickly had some data around social determinants of health, but I'm going to pass it back to Dr. Aquino to talk about some of the reports.
Thank you, Gabriela. So I hope that that information really painted a picture for you all of the community that we all come from, the community we're representing, but also the community that we're serving. And so for all of our promotoras here today, a huge thank you, because this is the work that you are doing day to day. These are the issues that you're addressing with, be it a call, be it a visit, be it a text message over WhatsApp, whatever it is, and in whichever way that you are involved in the health of our community, you are doing this work. So thank you for that. Both of our organizations, TCP and LCHC, this year had the opportunity to put out some reports around the importance of promotoras. And so during this next portion of our conversation today, we want to move our conversation forward from painting a picture of who we are and who we're serving to what are equitable solutions to ensure that our promotoras doing this wonderful work really do get recognized, not just verbally, because many of us, do that, but how do we actually set up policies that recognize the power of the promotora in a way that is sustainable, be it by salary, be it by benefits such as health insurance through their work. And so we'll be having that conversation right now. And for our first report, I'll pass it back to Gabriela.
Thank you so much. Next slide, please. Great. So our report entitled Community Health Workers Advancing Child Health Equity is really the culmination of listening sessions that we've been hosting in both English and Spanish in the last year and a half with members of a community health workforce, including promotores across our state who work with partners who are leading the way in advancing child health equity for children. And this research really highlights the work that you all are doing on behalf of kids in our state and really highlights how promotores are a key component of addressing, eliminating, and preventing health inequities that impact children and youth and develop later on as they're adults. Next slide, please. Thank you. So I'm just going to go over a couple different key takeaways from our brief. And I encourage you all to check it out. We will definitely send these slides and then send links to the full briefs after this presentation. But the first key takeaway I'd like to start off with is that promotores really play a critical role in protecting, improving, and improving the health of children. Achieving health equity for children and their families really requires our healthcare system to intimately understand the communities that they're serving. And promotores have been on the front lines of promoting the health of the communities that they come from for decades. And in our listening sessions with promotores creating this brief, we heard specifically how promotores support the physical, mental, and social emotional well-being of children. Our listening session participants highlighted helping children and youth with mental health issues and adverse childhood experiences, things like low self-esteem, self-empowerment, bullying, trauma, suicide prevention, and also dealing with the pandemic. They also spoke about connecting children to dental and vision services as well. Building on these experiences that were shared during the listening sessions, one of the sections of our brief also provides specific examples across California of different promotores and community health worker programs that really have shown a demonstrated impact or show promise in advancing health equity for specifically Black, Latinx, and Native American children. Some examples included in the brief, for example, are a program called the Dulce model, which adds a community health worker to a child's pediatric team. And essentially, this community health worker connects families to legal services, helping families navigate immigration legal services, for example, and also provide services during the first 6 months of a child's life. Another example is the healthy home model. And this is something that came out of work in South Los Angeles with the Esperanza Community Housing Project, who partnered with promotores to address the impacts of environmental pollution on the health of children. Promotores went door to door, building relationships with families and informing families about the hazards of lead paint. And they realized as they were doing this that the children who lived in these households had never actually been tested by their doctors and often were misled about the test results. And as a result, the promotores who were involved in this project developed a policy campaign to address lead testing, which resulted in children in South LA getting more frequently tested for blood lead levels. Next slide, please. So like I highlighted just now, a second key takeaway about how promotores advance child health equity from our brief is really the unique role that the workforce plays in advocacy around improving the communities that children grow up in. The participants in our listening sessions really emphasized that children and families are facing a range of challenges during the pandemic, like lack of employment, lack of a living wage, food deserts, lack of transportation, lack of internet access, and other issues. And they talked about how they engage in advocacy at all levels to really address these issues and the many non-clinical factors driven by structural inequities that shape the health of their communities. And one of our participants, actually from Visión y Compromiso, talked about her advocacy work as trickle-down advocacy, where the advocacy that she does not only improves the communities that she's serving, but then also trickles down to the families that she is serving, where family members then learn how to advocate for themselves and for their children. Next slide, please. A third key takeaway I'd like to highlight from our brief within the context of a community health workforce and children is really that promotores break down silos and build bridges between the various government agencies that touch the lives of children. They help children and adults they rely on navigate multiple and complicated government systems, including education, healthcare, and social services. And the participants in our listening session really highlighted this and how they sort of act as that bridge between these different really complicated systems. And one participant in our listening session actually recommended that schools have promotores on school campuses, really playing that role as connectors between the education system and the health system. And that's actually a policy recommendation that we included as part of our brief. Next slide, please. A final key takeaway I'd like to highlight is a community health workforce really directly supports children with services and supports that don't only focus on addressing immediate serious health needs, but really in prevention, in preventing them from occurring in the first place. We provide a lot of examples of how community health workers and promotores prevent disease from developing later on. We provided examples around how they address environmental exposure that exists in communities, how they support maternal and infant health and early childhood development, oral health, mental health, all of those things. Next slide, please. And so this focus on prevention is why we at the Children's Partnership really strongly believe that a community health workforce, and specifically promotores, should be available to serve all children and families enrolled in Medi-Cal. And we're really excited about the development of a new community health worker preventive services benefit in our state, and are advocating for the creation of really a policy that also focuses and includes all children enrolled in Medi-Cal. And this is because our Medi-Cal system serves nearly half of all of our children under the age 5 in our state. And over 5 million children enrolled in Medi-Cal are 3/4 are Latinx, Black, Native American, Asian American. So we really see serving our Medi-Cal population, specifically children enrolled in Medi-Cal, as a key way to advance health equity, and specifically, again, integrating a community health workforce and specifically promotores in providing preventive services to all children enrolled in Medi-Cal. I will stop there and I will pass it back to Dr. Aquino.
Thank you so much for that, Gabriela. And, why are we talking about policies today? Promotores have been doing this important work year after year, many times for our undocumented community that serve as promotores. Many times they're not paid. They do this work out of the goodness of their heart. There are many barriers that come in between them and a dignified salary, dignified wages. And so that's what we're trying to fix. That's what we're trying to solve. How can we fix those issues so that the work that promotoras do, which is essential to all of our work within public health and in making it happen, be it, community members and families being able to access resources and public benefits, to the calls that help a family remember that they have to show up for a meeting or learning more about their health and how to better take care of it. So building on what Gabriela shared about just the importance of promotores, LCHC had the opportunity to work with some researchers this year to put together this report community health workers and promotores, investing in change agents for a healthy California. Next slide, please. So just to give you a short summary of the report itself, this report aimed to explore the current landscape of CHWs and promotores, the opportunities for meaningful policy change and a path forward in California, all while centering the needs of promotores and the communities they serve. Our researchers led an in-depth literature review, participating in listening sessions, case studies, and led a series of stakeholder interviews. The analysis of these 4 areas resulted in key takeaways and a set of recommendations in which all of us can collectively work on and move forward. Next slide. The 4 key takeaways include 1, sustainable funding streams moving beyond medicalization. 2nd, certification and training, tensions around equity and professionalization. 3rd, undocumented, inclusive CHW and promotora policies at the federal and state level and what those barriers are. And 4th, investing in the CHW promotora workforce, leveraging community expertise as a job skill. So I'll walk us through some of these takeaways one by one and highlight just a couple of important items in each one. We can advance to the next slide. For sustainable funding streams, one of the issues that promotores face right now is that historically, promotores have been employed by community-based organizations and funded through either a philanthropic grant or state, local, and federal grants. Over the last few years with the Affordable Care Act, the way that this shifted the workforce was really to be very specific around very specific health issues or disease specific involvement. And it did result in cost savings because it's promoting disease prevention, health promotion through education and connecting with community members through trusted promotores. However, this limits the way that promotores can engage in the whole person care. And as we discussed earlier, when we think about social determinants of health, we really are thinking about creating a culture of health, right? How does our housing impact the way that we can live a healthy life? How does the nutrition and the food that is available to us really impact that? So it's not just about addressing diabetes, maybe obesity, be it asthma, whatever the health condition is that we are facing, that is very important, but that's not where it stops. And unfortunately, the current funding streams tend to focus on those specific issue areas versus expanding the scope of services to include the social determinants of health and a way to fund the work of the promotora so that they can do that work as well. Next slide. Certification and training. So tensions around equity and certification. So pursuing certification is a central point in many states' decision around advancing the promotora workforce. Many states have embraced certification, and supporters argue that it's a way to streamline and standardize the work that promotores do. However, there are serious concerns with pursuing certification and standardized training, specifically around 3 specific areas, including immigration status, formal education, and spoken language. And what happens when certification is on the table is that it unfortunately creates many barriers for community members, especially undocumented members who are doing this hard work day in and day out. So these efforts of creating a state certification may unfortunately decenter the value of the experience, the wisdom, the community networks, both in trust and communication, that these community members and promotores bring to the table, and create extra burdens that actually limit their involvement into this very important work. So as we move forward, we really need to think about ways of being more inclusive and addressing those barriers from the start so that we don't exclude anybody in the process. Next slide. Undocumented workforce. What are the federal and state barriers? So undocumented community health workers and promotores are uniquely positioned to help immigrant and undocumented community members navigate health and social services. As we all know, even making an appointment to see your primary care physician can be burdensome, can be a process. Many times we have to wait and during a call for a long time, and sometimes we don't have the time to do that, and so we either forget or we postpone it, and this is where promotoras tend to help us make those connections. Unfortunately, being undocumented poses a huge challenge for undocumented promotores, and many times they end up doing this work in a free fashion, right? They're still putting forth their time, their work, but they're unpaid. They serve in informal roles. And many times they are working a full-time job without getting paid. And so something that we can consider in this conversation is bringing promotoras in and paying them through their individual taxpayer ID number, the ITIN. And this is actually something that we do at LCHC to ensure that promotoras are getting paid and they're receiving dignified wages for their time and their work. Next slide, please. Investing in CHW work and promotora workforce, leveraging community expertise as a job skill. So investing in the workforce is a critical chance to advance economic and social justice by connecting individuals who often struggle to find dignified, well-paying jobs to meaningful employment that addresses health disparities in their communities. And so what do we all think about when we're thinking about taking on a job, right? And those of us who have had the privilege to take these things in mind. A lot of it involved extra benefits, right? Are we receiving health insurance, dental insurance, vision, the opportunity to advance within your career, right? However, unlike health professions such as nursing or medicine, for which California has committed resources to that pipeline development, for training, for employment, there is no cohesive strategy currently to build and develop that CHW promotora workforce and create pathways to stable employment. Dignified jobs need to include, like I said, long-term positions, not the usual short-term contracts, which actually force promotoras to work multiple jobs. Their average workday is about 10 hours, if not more. They need to be well-paid positions. They need to include career growth opportunities and employment benefits such as health insurance. Next slide. So our report also goes into strategies. So there are three major strategies. One, building consensus and capacity around the community transformation model. Two, capitalize and expand existing state commitments to equity, be it through Medi-Cal and the workforce policies. And finally, expand the conversation beyond healthcare by centering promotoras in statewide equity and justice work. So we'll go through this. For the first one, building consensus and capacity. So the root cause of many of the tensions and challenges in advancing effective and equitable policy for promotores is a lack of understanding of who community health workers are and promotores and what they do for our communities, not just as health navigators or as health educators, but really as social change agents, like we said, addressing social determinants of health. And so there is some work that we need to do in terms of how we communicate the promotor narrative outside our groups, right? I'm pretty sure that everybody in this call today understands the power of promotores, but how do we communicate that within the policy discourse in the state in a way that can result in sustainable policy change? So we must translate the language of community transformation to the mainstream promotora policy discourse, helping stakeholders on all sides understand the health and social benefits that promotoras bring to the table when they're invested in and when they're empowered to operate within their full spectrum. Next slide. Capitalizing and expanding on existing state commitments. So, we have the privilege of living in California, which, tends to be a powerful place of visionaries that are trying to advance our health as a whole. And while it takes very intentional conversations, a lot of work and negotiation, California does make bold commitments to equity. And so we must capitalize and expand on these values in the way that we are implementing it across policy opportunities that may currently be at the table, such as CalAIM, which sets a clear goal of addressing the social determinants of health and alleviating health disparities faced by Medi-Cal patients, and leverage different commissions that we've had. For example, in 2019, we had the California Future Health Workforce Commission, and they recommended to scale community health workers, promotores, and peer provider programs through certification, training, and reimbursement. So there is a lot of work that we have to do to define those specific areas and advise the state how we would like to move forward in a way that is inclusive and that can last over time. Next slide. Expanding the conversation beyond healthcare. So we really must build cross-sector support, mobilize coalitions to secure new state investments. Promotores need to be embedded in the vision of a just society, forging new coalitions and changing the prevailing mindset and approach to promotores. So we have been stuck in this way for too long, right? Short-term contracts for promotores, where they do really hard work day in and day out. And 6 to 10 months later, they're done and they need to be looking for a new position, right? We are at the point where we need to stop that type of work and really think about integrating promotoras to our workforce in full-time positions. And that is just a way, we all preach equity within our different organizations. And when we are able to implement that for promotores, we are living what we're preaching, right? And so we need to do that for promotores. And the ultimate goal of the strategy is to introduce legislation and a budget request for direct state investment into grassroots promotores and organizations that support promotores. So in conclusion and next steps, we have outlined very clear pieces that we need to address. One, in addressing the acute needs that exist, so the now, and then the future. So currently for the now, I'll let Gabriela jump in to talk to us a little bit more about Medi-Cal and the CHW promotor policy.
Thank you so much, Dr. Aquino, for your amazing presentation that a lot of folks are giving you props for in the chat. So really quickly, there is a policy opportunity that currently exists in California. California is right now going through a process to actually create a dedicated community health worker benefit as part of our Medi-Cal system. And specifically, this was authorized during our last budget. Governor Newsom invested a significant amount of money in order to create this new benefit. And stakeholders are now part of a small working group who are essentially advising California and the Department of Healthcare Services on what this new benefit should look like. And something that we find really promising from this benefit is that the state is adding it under what's called a preventive services category under Medicaid. And essentially what preventive services mean are services that prevent disease or disability, services that prolong life, and services that promote physical and mental health efficacy. And essentially there is a federal policy that allows community health workers to provide these preventive services that are recommended by the language that they use in the law is recommended by a licensed provider. And so right now, this small stakeholder group, which the Children's Partnership is a part of, Visión y Compromiso is a part of as well, so is the Latino Coalition for a Healthy California. We are meeting right now to, again, really help the state develop its policy. And essentially what the state has to develop and draft as part of its state plan amendment to get this new policy approved by our federal government. It has to first include the kinds of services that the workforce will provide under this new benefit. So a lot of things that I was mentioning earlier around children-specific preventive services, for example. The second thing that it needs to include is it needs to define the qualifications. And this is something that Dr. Aquino was mentioning during her presentation, is we are really pushing for a policy that is as inclusive as possible of the workforce, including immigration status, language status, education. And we really want to make sure that this new policy integrates folks who have been part of a community health workforce, including promotores, for decades. And then the third category that the state has to define is supervision. And so the next meeting we have will take place in November, and we'll talk more about that a little bit later on. And I'll actually pass it back to Dr. Aquino to talk about CBOs.
Thank you so much. And, when we talk about the future in terms of implementing policy work takes a long time, unfortunately. It tends working on the policy itself, changing the narrative, building coalition, and it's important work, and we are doing it, but it will take a little bit longer than, how quickly we would like to have a solution on the table. However, there are steps that we can take now. And so I would like to bring our conversation into everyone's mind who is here with us today. If you are here with another organization, a CBO, or be a local entity that's working with promotores, I want each of you to really think about how you are promoting justice for promotores in each of your organizations. How are your promotores getting paid? Are they getting fair wages for the work that they're doing? How do we move beyond, right? Just praising them for the great work they do and recognizing them via dignified wages, protecting their own health as well. They play such an important role in promoting the health of our communities, but are we protecting their health as well? And so, let's really take ownership of how we are living out, like I said earlier, what we preach, and let's make sure to start implementing that to the best of our ability. For those of us who have the opportunity to apply for grants, there are many times that we can have these discussions with funders in order to create longer term contracts with promotores, so that it's not just short term. And the ownership really falls on us for the now to address that and bring that forth in conversation. So making sure that our promotores are getting paid, that they're getting paid well, that their health is protected. If we're not offering health insurance or other benefits, are there other ways that we can provide, be it a mental health day that a promotor might need to take after a very long day of work? So let's really think about that so that we can be helping promotoras in the now. Many times as well, as I mentioned earlier, undocumented community members are paid a variety of ways. Many times it's a grocery store card or a gift card. And as we know, gift cards don't pay rent. So let's make sure that we are figuring out creative ways to bring those undocumented members to the work and paying them, be it a salary, at a contract, and making sure that we can pay them through their ITIN numbers, because we know that undocumented members pay taxes, they have an ITIN, and they can be brought onto the team through that and get paid well. So I will stop there, and I'll pass it back to Visión y Compromiso with Alma. Thank you.
Thank you very much. This is Maria, and I don't see me on camera, but that was extraordinary information from the both of you, both in the data presentations, Gabriela, and the impact that our children are suffering from not having full access and equitable access to services, and really identifying what their issues are at the local level that are either because of access to healthcare or just social determinants and where they live. I think that's really critical. And the thing that struck me was the huge number of our children that are at risk. And as we start to think of the recovery, what does the recovery mean? Then where do they fall into that? And certainly our concern for education and lack of education for them for these last 16, 18 months. So I really appreciate that. And Cecilia, your information is extraordinary. Also, I would like to note that the transformation model that's coded in your report is based on our community transformation model. So I would like to toot that a little bit and give credit to what we've been doing. And the policy piece, I think, is really important. You noted that it takes a long time. I really want to highlight that. We're part of this discussion with you, Visión y Compromiso, with the Department of Healthcare Services, and they're open to the discussion, but it is going to take time to submit something to the federal government to change it. I would like to note a couple of things in what you said, though, that there is a distinction between a community health worker model and a community promotor, and they're not to be said in the same breath because there is a distinction. And as you mentioned, promotores are grant funded. They're on soft money, and so that is what leads to them working a short time or receiving this in unequal pay. But they're getting that funding stream, and so this money that's coming from the governor, which I love that you mentioned that, and he was so thrilled that he could support community health workers through Medi-Cal, doesn't allow for those funds to go to community-based organizations, which is where most community promotoras work. And so I think that, I know that in the work group that we're in, we're talking about that, but I just want our audience to know that we understand that distinction, and we're advocating at the same time for funding to go to community-based organizations so that they can hire community promotoras. And that's where part of this equity comes in so that they'll have a living wage, they will have benefits, and they'll be able to stay with the agency for a longer period of time because the grant money won't end that quickly. And secondly, to your statements about education and conformity and consistency, that's always been our concern because there's so many variations of the model, whether it's a promotor, community health worker, but what we do know is that there are many longstanding organizations who've been doing this work for 20, 30, 40 years. So for those agencies that are listening, if they would look to the experts that exist, those that have been doing this work for a long time, and I would caution agencies to not recreate a model without really researching what exists, and also not to recreate it in their own image. Take elements of the promotor and then recreate it in an institution. And for those of us who are in the community, we have formed a collective voice called La Alianza that we invite you to join so that we can start to understand these larger implications. And as you said, advocate as a whole. Our workforce papers are exactly that, where many years ago we came together, as Alma mentioned, and we decided these were the priorities. Now the next step is for us to come together, and hopefully you'll join us, both Latino Coalition as well as Children's Partnership, in forming these things and developing a next step structure so that it is our voice that's at the table as community-based organizations representing promotoras. I'm so thankful for this conversation. Your papers I hope are available to everybody, and I think they should read them. They're informative, but they're supportive of the work that we do at the community level. A question I do have, though, is When we look at organizations who want to understand the model better, what is a key point you think that they should consider when wanting to integrate or expand the model? Either one of you.
The promotora model.
Yes.
Yeah, definitely. I would say, really take the time to understand the role that the promotor would play within their organization, not just externally, but also internally. How are we communicating? Who is a supervisor to the promotor? Do they speak their language? Do they understand the work that they do? Are they respectful? As we know, be it with formal power or informal power, we are all owed that dignity. And so making sure that the way that we are treating others through our organization carries that dignity and that respect. And so that would be one. I think two, really taking, like you said, all the wonderful resources that already exist. And like you mentioned, Maria, Visión y Compromiso has been doing this work for so long. There are so many resources that our researchers actually looked at to put this report together. And so if organizations are thinking, maybe this is the first time that they're engaging with promotores, or they want to engage even more, taking a look at those resources, consulting you all, feel free to consult with LCHC and TCP on how we do the work as well with promotores. We would be happy to brainstorm, to think together. We don't have to do this work in silos. We don't have to recreate the wheel, right? Many times it just takes a 30-minute conversation on the phone to really figure out a plan that would work. And we're always more than willing to have those conversations to support.
Gabriela, do you want to add to that?
Yeah, I'd like to add two things. The first one is to really consider, which I think is so amazing about the community transformation model, is the difference between individual level services and services that result in improved communities. And also considering that second part of community level interventions as just as important, and the advocacy that promotores do to improve their communities as just as important as the individual level services that they provide to protect the health of the children and families that they serve. So that's the first thing. And then the second thing is just don't forget about children. I think often children in health conversations tend to get lost. So when considering how promotores in an organization can serve a community, also consider how they can serve the children who live in that community.
So important. The children are our future, so important. And we do forget their needs, both. You mentioned oral health, which we were in an oral health project for a long time. Just even now with the pandemic, their emotional wellness, what have they had to deal with being at home and we do a lot of wellness webinars for families. And one of the areas that we did focus on was families being together, not working, not being in school, the stress that causes, and then falling behind in school because they don't have internet access. They don't have a tutor. They don't have these things. So I think there's a lot for us to talk about in the future, Gabriela, regarding children, and certainly the whole person well-being to see that we're going to have to see. You did mention CalAIM. And CalAIM, for those of you who don't know, is a project from the Department of Healthcare Services that they're coordinating it, where plans are expected to do certain things. It's too large of a discussion to just go into detail. But one of the places I was interested in was they're obliged to work with CBOs, with community-based organizations. That has not been fully defined. I think one of the places I would like to partner and for us to look at bringing this alianza together is really to see how it is that we can advance that. We say that a warm handoff from a doctor is to the community-based organizations, because they're the ones who have these resources, who are able to do the day-to-day. And how do we support that? How can we become, how can that become a richer discussion in the CalAIM force, do you think? How could we advance that? And then just some suggestions at how can we, as a community of promotores, us and our partner CBOs, how can we be more present in that discussion?
Yeah, definitely. I think I can start, and then Gabriela, please feel free to jump in. I think there are many there are many points of conversation as these items get implemented, right? We're looking at implementation dates starting as early as 2022, and we saw a delay in implementation because of COVID-19. But as those items are being implemented, there are points where we can come in for a public comment, or we can submit a letter guiding the officials that are supporting the implementation of CalAIM and the many parts that are included within CalAIM. And so, you know, to connect it to the report and what we were talking about, one of the recommendations is guiding the narrative, right? And I think promotores already have the solutions in their hands, and all we need to do is put it on paper, you know, highlight what we want to see out of this work, how we would like to see it implemented, and submit that. Try to schedule calls with the administrators that are working on this powerful work, and you know, get our word and our ideas in there and advocate for the right implementation.
Gabriela?
The only thing I'll add to that is I think, so in my experience in this sort of field, you have the kind of high level policy that's being created that most people are talking about. But then you also have these behind the scenes implementation letters that go out, like the all plan letters, the guides, the manuals. That's really where the heart of everything lives. And so I think I 100% agree with Dr. Aquino, and would just add to really target those implementation stages. Draft the all plan letter, right? Like offer specific language of what should go into it. I definitely think there are still key opportunities in implementation to really spell out what the vision is for the CBO accountability population health management piece that has been described a little bit, but not very much in detail.
It hasn't. You mentioned a little bit about consistency. I want to say that we're really, as an organization, we're concerned with the idea of training and consistent training and equitable training. All promotor training is not the same. All community health worker training is not the same. And it is an issue for us as we our network of promotoras y trabajadores comunitarios, when we see such disparities across the state and other states. We have, as Alma mentioned, we established a long time ago an institute of promotores where we constantly are working on curricula and on advancing the expertise of the promotor. So we have leaders and we have experts and we have a training of trainers. And I think that kind of concentrated effort has to be recognized and acknowledged, that we are crafting our own expertise in the community. Many of us are doing this. And for others not to come in and try to replicate it because there's funds that are going out. We really want to caution that, and for people to look at what's behind the name and what's behind the organization. I wanted to mention that because we know we are seeing that in many places. I did want to mention one thing as you were talking about CalAIM and state plan amendments and letters of support, that in the governor's statement about community health workers and the funds to Medi-Cal to support that to me, that's an example of where the devil's in the details. The governor had just been to Tiburcio Vasquez and had seen the wonderful work that the promotoras were doing in the clinics, but they were volunteers. And then he had been to Coachella and he had seen much of the work that had been done there by promotoras, who were, some of them were ours, but they were paid. So when he developed this line item, it was community health workers and Medi-Cal, not understanding the distinction and the nuance that money is not attainable by community-based organizations who support the community promotor. That's an example of where having us community at the table is so important for administrators. And I know that you two know that, and I know that you advance our work and the work of community-based organizations, but for the audience to know that that's how simple something can go a mess because a few words and there wasn't enough understanding of what the implications were there. So that's why we're having these meetings with DHCS and trying to correct that. and hopefully they'll allow funding to go to community-based organizations. But it's a long way of going around when we could have done it easier. And I think for those of you who are on this call, join us in our Alianza, join us in bringing the voice forward, whether you're a small and medium-sized organization with 1 or 2 or 3 promotoras, or you're a very large organization, or you're a training institute. We would love to share, to compile, and to offer 21 years of expertise along with our partner organizations, and you mentioned a few of them, so that we can get on the same page and we can advocate in the same way. We're closing to an end, but let me ask you, do you have like a special message you want to send out to the organizations that have been listening, or to the promotores themselves, who I know you have met and you admire and you love promotores as we do? Is there a message you want to send out?
I would say muchísimas gracias to our promotores, right? I think what you heard on this call today regarding how we want to fight for your rights is very close to our hearts, right? We see our own families reflected in you all. We see our tias, we see our moms, we see, the lovely people that raised us. And, we have the privilege to sit in these positions now with, having had the privilege to receive formal education, etc., because of the sacrifices that our families did for us. And we thank all of you for the million sacrifices that I know that you do for your own families, for our community. And, I would encourage all of us, including organizations on here. I know we have a variety of people joining us in the audience, but if you work for a foundation, for example, thinking creatively, partnering with CBOs and organizations in ways that can center and that can provide those dignified wages for promotores, thinking about long-term sustainability of those pipeline programs to develop that workforce in the state. And for any other organizations, if you need support in thinking about how to implement the frameworks and the models, to reach out. Don't try to do it in a silo. I think we're stronger when we work together. And so making sure that we keep that in mind as we continue to do this work.
Let me just add to that, if I can. You mentioned foundations. Such a great word. Foundations seem to go in cycles, and we've been involved with foundations for 21 years. There was a time when they wouldn't even let us in the door. And now promotoras are popular, and everyone wants they say, quote, a promotora. I think that what's important in what you say is go to the source, go to those who've been doing this work for a long time. I would question those who are just coming into the field and how much do they know. We have experts. There's so many community experts. There may be a little group that has 20 promotoras, volunteers that are doing day-to-day work, taking food, they're changing their community, and they maybe have staffing, or they don't have staffing. I think the perception of what is a viable organization has to shift for foundations and really look at how to support that grassroots community and how to help them partner with other organizations. So if any foundations are listening, please, we're happy to chat with you. We're happy to share whatever information that we have and resources so that you can be informed about the reality in our community. Gabriela, did you want to say something? I had to interrupt there, I'm sorry.
No problem at all. Just a couple of thoughts before we end, reiterating everything that you and Dr. Aquino said, and really just emphasizing that we really see this workforce as an anti-racist strategy. Our healthcare system has for too long been controlled by people who really don't understand the experiences of beneficiaries or consumers. And a community health workforce, and specifically promotores, are folks who understand those unique needs. And anti-racist strategies are really conscious and deliberate efforts to shift power and give power. And by investing in a promotora's workforce, you are centering those people with lived experiences in a system that has historically excluded them. And so we also really want to emphasize that aspect of it, because our state right now has been throwing out terms like health equity, anti-racism, systemic racism, without really putting teeth behind that. And investing in promotores and the CBOs specifically, because that is also shifting power to the CBOs that support promotores network. By investing in both promotores and those CBOs, healthcare systems have a great anti-racist strategy to shift their power. So that's what I will end on.
Oh, Gabriela, thank you. Such powerful words from the both of you. And Gabriela, I so agree with you. And I would add to that, caution our legislators not to go for the likely candidate, not to give you so much money to the universities, to the community colleges. While those are options, many of our people do not access those. We know if you look at our educational rates. The equity issue is at the community level. The equity issue is giving, we know that a job will transfer a family's trajectory, social determinants more than anything. We hire a lot of promotoras. They come right off the field. We train them. Look at our workforce papers for the audience. We train, we do project management. They become coordinators, they become managers, they become directors. We have the model that will show that if you put the work in, that the promotor can not only continue to benefit our community, but they can have equitable jobs. They can have an income. They can have retirement. They can have benefits. All those things that we take for granted. I do agree with you there. And I really appreciate that you mentioned the equity discussion, because it's an intellectual discussion at some point. It is those who they think should be in the discussion, but really they're looking at us as a third people, third degree, those people, those promotoras, them not bringing us into the conversation. And I have yet to sit at the governor's office and have them ask Visión y Compromiso, what do you think? Now, all this discussion that's going on, nobody has asked Visión y Compromiso to sit at the table and to ask, what do we think? So I encourage, if any of you from the governor's office are listening, come to the source, ask us, we're happy to share. With that, I do have a recognition I want to read. This is a recognition that the governor has given to Visión y Compromiso. And while I just said that we're not invited to the discussion, we're invited to the table, this recognition is for all the work that promotores have done in the pandemic and the recognition of going above and beyond. So I'm going to read this because I think it's important for the promotores who are listening to hear this. It's dated October 7th, and it says to Visión y Compromiso, on behalf of the state of California, I commend Visión y Compromiso for their steadfast commitment to lifting up the health and well-being of communities across the state. By investing in promotores, community health workers, and other grassroots community leaders, Visión y Compromiso stands as a champion for expanding healthcare access for all. A linchpin in this movement has been overcoming linguistic and cultural barriers that exist between healthcare providers and members of our most vulnerable communities. Visión y Compromiso are trailblazers in this mission with their unique partnership with promotores that ensures the organization has a keen understanding of community priorities and is well positioned to promote needed services. I take great pride knowing Visión y Compromiso is dedicated to realizing our shared vision of a healthy and dignified living for all families, particularly among Spanish-speaking and immigrant families. Nowhere was this more present than the past year as promotores and community leaders traverse the front lines of the COVID-19 pandemic in these communities to provide outreach and education, distribute emergency relief funds, coordinate testing and vaccinations, and reduce vaccine hesitancy. Another measure of support for your efforts is the addition of community health workers as a recognized benefit of the Medi-Cal program. Please accept my sincere gratitude for your contributions to the Golden State with 21 years of achievement engaging community leaders and Spanish-speaking families throughout California. I know Visión y Compromiso is poised for a future of continued success. Sincerely, Gavin Newsom, Governor of California. This to me opens the door for all of us listening, promotores, trabajadores comunitarios. This recognition further opens the door. See, the Children's Partnership and Latino Coalition have nudged it open a little. Now it's time for us to go through and break it wide open, have conversations through our advocacy days, our legislative day. Our legislative day will be in May. We hope to bring 100, 200 promotores to advocate and to show our power. The governor has opened the door for us. Aquí estamos, ahí vamos. Thank you two so much. It's such a pleasure to know you and to see that you're with such wonderful organizations. And for those of us to see our future, we always want a future and better, everything better for our children. You are a great example of the future for our young people. Muchas gracias.
Muchísimas gracias.
Thank you so much.
Thank you, Dr. Aquino, and thank you, Gabriela, for sharing with us all those different reports that you put together and all the knowledge that been getting. I'm looking into the questions in the chat. There is not many questions, or there is no questions in that, but a lot of comments about the wonderful job and the wonderful information that you share. What I can see from the audience is that very, very, very emotional and thankful of all this information that you've been sharing. Promotoras are being comment about the necessity of continuous education, continuous training, provide them with the resources that they need, not only make available the training for promotoras, but that is training that also have in mind their own necessities, that being in Spanish, that sometimes paying for education is not possible. So putting that on mind. A lot of people is asking for the recordings, asking for the materials that you are sharing with us together. We mentioned that after the conference, we will instruct participants where to find these materials. Of course, we want to share with you all this information. Also, the immigration status of promotores, making sure that this is in the table. The needs of the promotores, then the needs to be able to work in the United States because they are doing it already, but just been recognized that, and also make sure that this is included. Melinda, you are seeing the comments. Is there anything that brings your attention that you would like to share with all the participants? We have people from Chicago, from different parts, but from different states. Let me look through the comments to see anything else that grabs my attention. Other things that they've been sharing is how important it is to know the status of the Latinos in this pandemic, the impact this pandemic has on Latinos, and also the children that has lose their parents because of this pandemic, how important is for us to be aware of those consequences.
I think, Alma, and thank you, just to add to what you've said, really there's been a lot of affirmation for what the panel has mentioned today, and really a focus on centering the promotor, the community. And I think that you both spoke to that. And I think through that, we can build pathways, equitable pathways for promotores to advance in their trajectory and in their employment and in their careers as promotoras. And so there's a lot of comments that have to do with that centering of the promotor and really looking at them and the workforce. And through that, like I mentioned, building that equity. So Alma, I know we're at 3 o'clock, and so I think, compañeras, it's been a wonderful ride, lots of interest here, and we look forward to sharing your materials forward. Lots of people have asked for those, and we've been trying to keep up with all those comments to let everybody know that we will send those materials. We will have those available after the conference, and we will let you know how.
And Melinda, and if you just allow me to add, just to closing the session, and of course, thank you to all of you. Thank you, Maria. Thank you, Melinda, Gaby, Dr. Aquino. I want to mention that part of Visión y Compromiso today, she is not with us, joined the conference, but we have our workforce manager, Miriam Hernandez, and you can get in contact with her and advance all those conversations about training, about reaching out to organizations, about advocating as promotoras for advancing the workforce. So I want to say hi to Miriam, and also let all of you know that we've been working, and especially her, working diligently with promotores and organizations to advance the workforce. Thank you so much for all your participation. Thank you so much for your time. And we will continue the Alianza. We will continue the conversations, because this is an ongoing process for Visión y Compromiso and for all the promotoras.
Adios. Thank you.
Thank you. Have a good one.